The Joint United Nations Programme on HIV and AIDS, UNAIDS, has raised alarm over the increasing incidence of HIV among young people in the Caribbean, highlighting countries like Guyana and Suriname, which reported alarming rates of 14%, while Barbados is recording numbers as high as 37%. According to regional health officials, this trend necessitates immediate scrutiny and action. During a recent interview with Jonelle Benjamin, Program Coordinator for the National Infectious Disease Control Unit in the Ministry of Health, it was disclosed that a lack of education about healthy sexual practices and a lack of political will poses the biggest challenges. Benjamin said records show the prevalence of the disease is mostly among young people, adding that for the past 6 to 7 years, Grenada has maintained its numbers between 20 and 25. However, last year was one of the highest recorded during the period, with 29 new cases, and men being those with higher infection rates.
So our age range for new infections has always been and remains between the age of 20 to 45. At some point, a few 5-6 years ago, we were at 25. Now we have gone down to 20. That is slightly alarming because it means that our younger population is now becoming exposed at a higher rate.
UNAIDS Multi-Country Director Dr. Richard Amaya emphasized that despite some progress, the decline in new infections among adolescents remains sluggish. He noted that globally, individuals aged 15 to 24 account for 28% of new HIV infections, with the Caribbean mirroring this concern at 27% of approximately 15,000 new cases. UNAIDS said the plight of children and adolescents is equally dire, with 2.38 million young people worldwide living with HIV as of the end of 2023. While treatment coverage has expanded in the Caribbean, with 70% of people living with HIV now on treatment, significant challenges remain. Late diagnosis and difficulties in enrolling and retaining people in care continue to hinder progress.
So our numbers thus far from 1984 to now, we have had 785 persons registered with HIV. All right. However, out of that 785, we have to minus our deaths, and our AIDS deaths were 319.
UNAIDS noted that the stigma surrounding HIV remains a formidable barrier, and young individuals fear rejection and discrimination, which discourages them from seeking testing or treatment. Girls and young women face heightened risk due to gender inequality, early sexual debut, and gender-based violence, while marginalized groups, including those engaged in sex work, are also disproportionately affected. Christina John, GBN News.